You're watching Homeopathic Remedy Update. Your hosts, Brian Kunakom and Virgil Tanazaki.
Hi, I'm Brian Kunakom. I'm Virgil. Here's tonight's top female remedies. Magnesium phosphoricum is a mineral remedy, and if we remember minerals, they are evolutionarily being built so that they center their problems around the structure of the organization. They have issues being somebody and often ask questions such as, how much am I worth? Or, can I make it? Recall that phosphorus component has no boundaries and is friendly to everyone. Phosphorus is an element that has a high reactivity and is never found alone by itself in nature. This can be compared to how phosphorus does not want to be alone and fears darkness.
Phytolacca and Colocynthis are plant remedies. Plants are quite sensitive to their environment because they are not mobile. Just like plants, the plant remedies try to adapt to people and their environment. Colocynthis is a sharp and prickly plant, and just like someone getting pricked by one of those plants, Colocynthis is easily angered and dislikes humiliation. Phytolacca is a plant with small seeds and a hard shell. Lacca in Greek means red dye. This can be compared to the hard, swollen, hot, painful breasts in female patients.
Very intriguing. We're going to have a short commercial break, and we're going to be right back.
Due to financial difficulties, we are unable to continue broadcasting. We will now be presenting a voiceover PowerPoint.
Magnesium phosphoricum. Before we get into the modalities of the remedy, let's take a look at the element magnesium phosphate. An imbalance in our magnesium causes nerves and muscles to get out of sync. They cramp, spasm, and shoot off pains. An imbalance in phosphates disturbs our vitality. Found in muscles, nerves, brain tissue, spinal marrow, and teeth, the compound magnesium phosphate is vital to proper communication throughout the body. Magnesium phosphoricum is best for spasmodic conditions and neuralgias. Modalities. MAG-Phos symptoms are better with heat and with pressure. They are better in warm places, and rest relieves many complaints. For women, dysmenorrhea is better with menses. Symptoms are worse with cold wind, and in cold places. Motion can bring out symptoms. They are also worse on the right side. Overall, they are worse in cold, damp climates, but they thirst for cold drinks. At the bottom of the slide, you can find a list of keynotes. MAG-Phos is an acute remedy indicated for cramping muscles with radiating pains, for neuralgic pains that are better with warmth, and that are predominantly right-sided. The pain quality is said to be violent and radiating because it affects the nerve. From Kent, Magnesia phosphorica has tearing pains that shoot like lightning along the nerves and are relieved by heat and pressure. And just to compare, MAG-Phos does not have the anger element causing the spasms that we see with Colocynthis. For women, there can be a membranous dysmenorrhea, with menses that arrive early and that are dark and stringy, and neuralgic pains affecting the ovaries.
The next remedy is Phytolacca, which you might remember from bot med as poke root, an herb that's indicated for swollen lymph glands. The homeopathic remedy is no different. Phytolacca has an affinity for the lymph nodes and glands, such as the mammary glands, tonsils, parotid glands, and testicles. A Phytolacca patient will be very sore and achy all over their body, and will feel the need to move around, but this only makes them feel worse. The Phytolacca patient is aggravated by cold, particularly damp cold, They're worse at night, and as I said, they're worse with motion, although they will want to move. They're worse getting up from bed because they experience vertigo upon rising, and they may even faint. Because of their sore throats, they're worse swallowing, especially hot drinks. The Phytolacca patient is better laying down, on their abdomen specifically. They like cold drinks, which I'm sure is soothing to their swollen, sore glands. They're better with rest, warmth, and dry weather. So imagine a person laying on the beach in the sun on their abdomen with a cold drink next to them. That is Phytolacca's ideal state. Although Phytolacca is more of an acute remedy, indicated for pharyngitis or mastitis, the mental-emotional picture is that of a person who is totally indifferent toward life, convinced that they're dying in the near future, and thus are totally apathetic and unable to do mental work. Phytolacca is one of the best remedies for sore throat. The throat of the Phytolacca patient will be inflamed, sore, burning, and red at first. If the infection is left untreated, eventually white spots will appear, which can eventually coalesce and form membranes, as seen in diphtheria. Because of their burning throat, they of course cannot swallow anything hot, and their throat pain will extend up to either one or both of their ears, especially when they're swallowing. The more constitutional symptoms include headache and backache, and a sore, bruised feeling all over their body. They have a high fever and a quick pulse, but their heat is mostly in the head and face, while the limbs are cool. This is similar to arnica. One of the more peculiar keynotes of Phytolacca is that they have the desire to rub their gums together, which is called dentition. And as far as the female-specific indications go, Phytolacca is a great remedy for treating mastitis. The breast will be very hard, swollen, hot, and painful. When the mother is nursing her baby, the pain will radiate all over her body. She will be feverish with a headache and backache. Similar to rhus tox, the Phytolacca patient feels they must move, and similar to bryonia, sitting upright makes them feel faint and dizzy. Both Phytolacca and arnica experience the whole body bruised and sore feeling, but to differentiate Phytolacca, the pain will run down the outer sides of their limbs, which is the sciatica noted on the slide. It is said that Phytolacca lies somewhere between rhus tox and bryonia, and this remedy will often help if these other remedies seem indicated but fail.
Colocynthis, or bitter apple or bitter melon. Now, although we didn't include a slide with its image, take a moment and look at the fruit, for it will really help you remember some of its keynotes. Now, just to briefly explain, the bitter apple or melon has a very spiky or prickly exterior. So colocynthis is a constitutional remedy, and its picture reveals an individual with strong opinions for what is right and wrong. This can be deciphered from a causticum type because it is when colocynthis is contradicted or feels slighted, they become very upset. So this is a good remedy for complaints after becoming angry, after indignation, or humiliation. For our purposes, we will be focusing on how this remedy can be utilized for female menstrual cramps. Oftentimes, these cramps are brought on from being angered, and I would even want to say as much as suppression of the anger. When they are angered, they may experience immense pains that feel like a spasm or twist them up inside. The dysmenorrhea also is described as squeezing that is better with pressure, heat, and bending over. The individual may become rather restless, especially during the pains, and they'll try to get up and move, but with eye movement, things become worse. The menstrual cramping or pains may also be accompanied with nausea, vomiting, or diarrhea. When this remedy was being proved, the prover experienced neurologic pains that came in waves along the big nerves, leading them towards great irritability. The neuralgia was often explained to feel like little ants that were crawling all over their skin. The pain could be so severe that it caused them to be rather restless, as previously mentioned, and everything vexes the patient. So a keynote for this remedy is pains that is worse with vexation. The pains may also cause the individual to scream out. And in time, maybe because the patient was so overcome with the pains, they would decline to talk to anyone, answer questions, or even see friends. And all they wanted to do was be left alone. Now, I would suggest keeping in mind while studying this remedy that there may be a link between this anger picture that was previously described and the neurologic pains that they experience. Also, I'll just read through the symptoms. As mentioned, there was restlessness, especially during pains, caused them to move and get up. The pains would twist them up inside like a spasm. They'd also often experience dysmenorrhea with violent menstrual cramps that felt like squeezing. The pains came in waves all up and down their nerves. There would also be severe tearing neurologic pains and numbness, prickling, and tingling along the nerves that felt like crawling ants. And if you keep in mind that picture of the bitter melon, it has a very prickly skin. So I think that kind of plays nicely into this image of crawling ants.
Hello everyone. This is a quick reminder of Pusatilla. Pusatilla is a plant remedy. As you recall, plant remedy are very sensitive to their environment. Pusatilla has purple flowers and is being used to treat premenstrual syndrome. Before I proceed, allow me to play some music, since it's too quiet around here. Before I dive into the specifics of Pusatilla and the female reproductive system, I want to give an overview of Pusatilla that we've encountered in the past. Pusatilla is associated with weakness of the stomach and indigestion, or even with menstrual disorders. Pusatilla has changeable symptoms such as thirstless, peevish, and chilly. The mind component, Pusatilla is known for being nervous, fidgety, and easily led and persuaded. They're also gentle, yielding, and weeping. They seek open air, which means they're better open air, even though they're chilly. They fear being alone, and they fear being in the dark. They definitely desire sympathy. The discharges are yellow, green, thick, and bland. Pusatilla is worse with heat, worse with rich fatty food, worst after eating, worst in a warm room, worst warm applications, worst with rest, and worse towards the evening. They're better with open air, better with slow motion, better with cold applications, better with drinks, but they are thirstless. If we apply what we know from the general picture to the female reproductive system, you would probably be able to deduce that their changeability would make them have irregular menstruation, or sometimes amenorrhea. Since menses can be considered a discharge, it will be thick, clotted, and scanty. Their menses are often suppressed because they're nervous, or they're deficient in a mineral such as iron. They may have diarrhea during or after menstruation. Other symptoms are listed on the slide. Here are some of the male-specific symptoms. They may have long-lasting morning erections. They may have sexual excesses resulting in headaches, backaches, and heavy limbs. They may have burning and aching of testicles with or without swelling. They may have orchitis. They may have swelling from suppressed gonorrhea or mumps. They may have urgency or dysuria, usually the burning type of pain. On the behalf of Group 4B, I would like to thank all of you for listening to this presentation. If you have any questions, we'll be taking them during class. May you go gently, knowing your goodness. Ding, ding, ding.